Hello everyone, and welcome to the third lecture of Lifespan Development, Chapter 8. This is preschoolers, generally categorized in the 4 to 5-year-old range. Preschooler appears taller and thinner than toddler, which may be mistaken for weight loss by the child's caregiver. The heart rate of a preschooler is usually between 80 and 120 beats per minute, and his respiratory rate is about 20 to 30 beats per minute. A preschooler can stand on one foot for 10 seconds or longer, hop, swing, climb, and may be able to skip. He begins to skate and swim by age 5. Most preschoolers can dress themselves and brush their own teeth. Children this age have a better understanding of the concept of time and can count to 10 or more objects. Their attention span increases and they have a vocabulary of about 1,500 words. Excuse me. Sentences now consist of 6 to 8 words. A preschooler can correctly name at least 4 colors and can say his name and address. He understands a 3-part request, such as find your teddy bear, pick it up, and bring it to me. His speech is clearly understood by strangers. A child of this age likes to sing, dance, act, and wants to be like his friends. A preschooler is certain that he knows everything and may be rude when you ask him to do something he does not want to do. He is able to play more independently and may be able to spend more time apart from his caregiver without becoming too upset. Preschoolers explore their bodies and find playing, quote, doctor an interesting activity. You can really use this to your advantage, handing them the stethoscope, let them try and listen to mommy's heartbeat, giving them a electrode, calling it a sticker, letting them put it, maybe on their forehead and letting them press the button, and you can find interesting ways to play on that. Preschoolers are afraid of the unknown, the dark, being left alone. They're afraid of adults who look or act mean. They may think that their illness or injury is a punishment for bad behavior or thoughts. You may hear them say, "Oh, I'm so sorry," after an event, after being sick or injured, and hoping that that will help relieve it. Approach the child slowly and talk to him at eye level. Use simple words or phrases and reassuring tones. Assure the child that he or she is not bad and is not being punished. A preschooler may feel vulnerable and out of control when lying down. Assess and treat the child in an upright position when possible. Preschoolers are modest. They do not like being touched or having their clothing removed. When assessing a child, keep in mind that he has probably been told not to let strangers touch him. Remove clothing, assessing a child, and then quickly replace clothing. Allow the caregiver to remain with the caregiver whenever possible. Now, there are scenes where this may not be possible. It's just, if it is, it'll help ease the situation if you can allow the caregiver to stay. Preschoolers are curious and like to, quote, help. That's a big thing. They like being your little helpers. Encourage the child's participation. Tell the child how things will feel and what is to be done just before doing it. For example, a preschooler may fear being suffocated by an oxygen mask. It may be helpful if you use a doll or a stuffed animal to explain the procedure. The child may want to hold or look at the equipment first. Avoid procedures on the child's dominant hand or arm. Preschoolers are highly imaginative. When talking with a preschooler, choose your words carefully. Avoid baby talk and frightening or misleading words. For example, avoid words such as take, cut, shot, deaden, or germs. Instead of saying, "I'm going to take your pulse," you may want to say, "I'm going to see how fast your heart is beating." Instead of saying, "I'm going to take your blood pressure," you might say, "I'm going to hug your arm," or I'm seeing how strong your muscles are." because they're afraid of blood. Dress and bandage wounds properly, of course, as always, but promptly. Depending on the child's age, you may find that distracting them is helpful. Remember that children are self-centered. They imagine that the world revolves around them. Paying attention to their world and needs will improve your ability to assess and care for your pediatric patients. Some good things that'll be helpful for distractions. Ask children about his or her favorite foods, games, cartoon characters, movies, computer games. Ask the child to visually locate an item in the area. Ask the child to sing a song or tell you about school. Use stuffed animals as a distraction or comfort item. Games are huge. Either asking them about games or playing I Spy, creating little games like that. If you ask a kid about their favorite cartoon character, they'll spend hours telling you about them. You ask my son Jace about the Transformers, he'll tell you all about Optimus Prime and Bumblebee. It's a really good way to help distract them from the underlying illness or injury.